All right, everyone. Hope everyone's enjoying the Demand Gen Summit. I am here with Patrick Ketchum, founder and CEO of 585 and Inlay. Patrick, thanks for joining us, man.
Yeah, absolutely. It's good to be with you, Billy.
Yeah. I'm excited to learn from you and have you share a few stories and insights. So before we get going, though, just for people that don't know who you are, let them know what you've done and what you're working on.
Absolutely. So, Patrick Ketchum, I'm from Indiana. I moved to Utah. Basically as soon as I got out of high school. I've worked a long time in politics, interestingly, and entrepreneurship are the only two things I've ever done. And so I've been in the last 10 years. I've been involved in two presidential campaigns and actually quite a few more. What happens when you jump on one of those is your guy loses, and then you jump on somebody else's until you find out who's going to win. And governor's races, Senate races, things like that, which is actually a really good preparation and background. It feels a lot like startup once you're
Yeah.
into that world, right? So you've got a limited amount of time to get a lot of people engaged in in a message, and so it feels similar. And then came here to BYU, came to BYU, started doing some entrepreneurship, started some businesses, and yeah, ever since then, I've just really gotten into this scene that is so prevalent here in Utah and so strong. And so we've been able to start quite a few interesting things. And I guess the pandemic has been very interesting for the businesses that we've chosen to jump into as well.
Awesome. And tell us a little bit about what 585 does and Inlay.
Yeah, absolutely. So 505 is essentially a ground operations firm. And so it does consulting, training, it does logistics and support for basically healthcare, medical resources, and we really do it across the country. And so if you need, in the pandemic, for example, if you need a mobile operations set up where you have vans going out and hitting people who don't have access to healthcare, testing, vaccination, other healthcare services, we figure out how to make that a reality. Inlay was something that came several months afterward, after we figured out it's really hard to get healthcare workers who are willing to go on the front lines, right? Not have a normal 9 to 5 job necessarily, or set shifts, more, spur of the moment. We've got an emergency. We need to, go to the Dolphins game in Miami and make sure that we can, start this and get them on the field at the right time. And so that really came out of an effort to get people engaged who maybe had full-time jobs, but needed a few extra hours on the weekends or at nights to help with this big global pandemic effort.
Awesome. So how did you get, so you got started with the Inlay based out of just the need you saw with the pandemic. How did 585 get started?
Yeah, absolutely. So you remember back last year in February, March, everybody's getting a little anxious about the pandemic. And I think it feels like it was March 11th or 12th when the stock market really took a dive. And a couple of the companies I was working on at the time, lost 50% of the revenues overnight. And so we had in that company I was involved with, we actually had employees across the state. And so it's like, okay, do we lay these people off? Do we make a huge push for contracts where we're doing the same thing? And so as we were brainstorming this, a lot of companies here in Utah decided to get together and find a solution for testing, right? Because first of all, you couldn't find supplies anywhere. You couldn't find, because the hospitals were using them or they were being seized by the federal government at the port of entry in LA and, on the East Coast, everywhere. Secondly, you didn't have very reliable tests themselves or laboratories where you could send them to. They were all at capacity. And then, really it was organizing healthcare workers who, because the hospitals were full, if you'll remember, and they were freaking out and they were sort of trying to overstaff in preparation for more people who needed to be treated for COVID. So they didn't really have extra people all the time who could do the proactive testing and tracing, making sure that, you're getting isolated and not spreading this to family members. So it really came out of that effort. And they came to me and said, my gosh, you've been doing, you've got all these employees across the state, but you also got this experience with creating an organization very quickly, presidential campaigns, other kinds of campaigns where you get a lot of volunteers, a lot of people together for large events, make sure that they're well organized, RSVPs, safety, check-in, registration, all that kind of thing. So it was a really good fit. And so immediately, Qualtrics, Domo, several of these large companies, engineering, software company, and I was thrown into the mix there. That's where 585 came from. It was really an effort to streamline all the ground operations to make sure that we had this organized enough so people could see, okay, I've got a tent in my neighborhood or 5 minutes away. How do I get signed up for that? When I get there, it's a 5-minute wait. They just scan my barcode. I get swabbed and I'm sent the results 72 hours later. At the time, that's how long it took. And so just automating that stuff, that's where that came out of, that effort. And then honestly, I grabbed all the people because of all this political campaigns and stuff. I had people all over the country. And so I was able to grab them and say, okay, hey, guess what? We're doing something new. And they became a part of the 585 team and started spinning up ground operations.
Awesome, man. Awesome. It was really impressive to see what Test Utah and the state could pull together so quickly. And we were happy to be part of it as well, putting chatbots and live chat on there to help people get answers. So how did you take that and expand out of Utah across the country? Because you guys are all across the country at this point.
Yeah. And like you said, there's a lot of partnerships in here. There's Nomi Health, Qualtrics, Domo, chat funnels, all kinds of great partners in this. And so we had immediately, maybe 3 or 4 weeks in, it's actually kind of a funny story. We had Ashton Kutcher, who has a relationship with one of our partners, who is from Iowa, who said, hey, these guys actually did something really cool in Utah. We should use them here. And so the governor kind of said, hey, let's give them a try. And, at the time when no one was flying, we jumped on an airplane, went out there and started getting things spun up. And it was incredible because we had, the full resources of the health department there to get us access to healthcare workers. And we also had, National Guard who were coming out and spending, time on the front lines. So it was really incredible experience. And that led to some work in Nebraska where we had a lot of similar things. I mean, absolutely everyone at this time is totally desperate to get a test. And so they had a problem of, lines around parking lots in order to get them people through. We came up with a model where we took a shipping container and basically we said, tents, especially in the plains, tents get blown around like you wouldn't believe. And so we took the shipping container, we put 4 doors on it, sliding doors up and down. So basically our nurses were in an environment that was totally weather controlled, AC, heat, and very efficient. And so we just sped it up like crazy in Iowa and Nebraska and other places. And actually in Nebraska, we got our first taste of, not only were we doing public, to the citizens of whatever communities we were in, we started doing things in prisons as well, in meat packing plants, in schools. And so, it gave us a really broad and varied experience in communicating with those people and figuring out kind of what messaging worked to bring people into that environment where maybe they wouldn't normally have access. A lot of people work, a lot of these folks who are most exposed, frontline workers, they work from these are hardworking people. They work from 8 a.m. to 5 p.m. They don't necessarily have time to come to one of the testing sites. So it's like, how do we identify those folks and get to where they are right now so that they can have the service? Awesome.
So with Inlay, I wanted to ask you, how are you attracting healthcare workers to join up and to do that? What's the offer? What's the appeal to them?
Yeah, absolutely. So, and this is something we really experienced when we went into Florida, because for the first time we were in a state that was big enough that really all these healthcare workers were already, they were engaged in other things. So they had full-time jobs, right? They were being sent up to New York to help. You remember that was just in
Yeah.
total free fall
It was a
at the time.
disaster
And
for a
so
while.
this, yeah, absolutely. And so the question was, how do we get more people engaged here locally? Because in that place, we did a model where had Sprinter vans go out to, they'd set up in Publix, which is, the biggest grocery chain in Florida,
Hmm.
Walmart, schools, churches, et cetera. And so what we were able to do with Inlay was kind of create a story where we were the facilitator, and the healthcare worker was kind of the protagonist, if you will, of this story, where the offer was not wonderful in a lot of ways. It was to be on the front lines, long hours, random hours, with people who thought they were sick. Right? If you're coming to get tested,
Yep.
a lot of times you think you're sick. And so we were able to, our biggest focus was understanding what story we needed to tell to help these people feel comfortable coming and performing this job. And it kind of took a couple of shapes. First of all, it's sort of an internal thing where, what benefit am I getting from this? And obviously, they're getting career experience, they're getting to help their own family
Yep.
return back to work. A lot of these people have their kids at home, and so either the husband or the wife will have to stay home while the other one works. And so it was a lot of internal motivation, a lot of external motivation about how are we going to get our communities back to where they are in places all over the country, but especially in a lot of places we were in Florida. Community is everything, and so the messaging is not the same wherever we go. Right? Maybe in the Midwest or in Utah, you could say something like, do it for yourself. Let's get over this, get back to things you love. There's a little bit more,
Yep.
do it for your family, do it for your neighbors. And we were able to bring these group of healthcare professionals in to help us really with this mission-based program. And it absolutely flourished to the point where we spread from, doing maybe 8 or 10 mobile vans in Miami to being spread out all across, from Miami to Sarasota to Orlando to Jacksonville to Tampa. And so, yeah, I think it was a lot about the message and a lot about, how we can show these people what they're really going to get out of this experience. And frankly, knowing a lot of them, personally, it's been incredible, the journey we've gone on together.
Awesome. Awesome, man. So you guys with underserved communities with vaccination.
Mhm.
So how are you doing the outreach? How are you getting in contact with people and essentially driving that demand for vaccinations?
Yeah, so we've done this in a couple of ways, and this is interesting because and we were, you know, we had this really cool opportunity. I remember on December 23rd, right before Christmas, we had an opportunity to start vaccinating. So we were one of the first companies, organizations, and again, a group of companies who are doing this together to be able to participate in the vaccination program. And at the time, you remember we started with 70 plus, and we
Yeah.
went down to 65 plus, and then 60, and then it varied from state to state at that point. Where we are right now, so now we're 3, 4, 5 months into it. Where we are right now is across the country, we've got 30 to 50% of adults who have gotten at least one vaccine ish,
Hmm.
depending on the state. And they've been reached out to, they've been marketed to, they've been pulled in, but they really wanted to do it, right?
Yeah.
And and the interesting thing is that white Americans have a 1.5 times higher rate of being vaccinated than other groups in the country. And so that's become the challenge: is underserved communities. Do they understand what the offering is? Are we making it clear? What are the pain points there? And really getting that
Yeah.
message out has been critical. So what we've done is we had experience with the mobile vans where we're getting out to communities and talking to them ourselves. So what we did was, going back to the campaign days and how do we reach people quickly, is first of all, we put up days in advance where we were going to be, through signage. Through, you've seen the big construction signs that you put at different work sites, slow down, whatever.
Yeah.
We'll just put free vaccinations this day, this day, this day in the neighborhoods that we're targeting.
Cool.
We did geotagged, geofence text messages, letting them know where we were going to be and what day. And so we could do
Hmm.
neighborhood by neighborhood, exactly, who was going to be, when this is going to be available, and who is going to be available for. And then we put a plan in place, right? And so, how much did this cost? Who was it available for? How is your
Yeah.
information going to be used? Some of these communities are worried, once the government has my information, is my legal status going to be in jeopardy, things like that. So we went
Yeah.
through and gave them a real good plan and said, if you want to keep your family safe, right, you don't have to worry about the cost. You don't have to worry about any, intrusion into your privacy. You don't have to worry about this being far away. And this is exactly what it's going to be. So just pushing away those barriers. And so once we did the text messages, couple of days before, we'd send robocalls to remind people uh, that we were going to be in the area, and then we go to Publix, we go to a Walmart, we go to a church, and that's one of the biggest things we did too. Is just the community partners, right?
Yeah.
You can you can have people reach out to you all day who you don't really know and who are texting you, and we can have good messages. But what we did is we teamed up with a group called the Minority Healthcare Coalition, which is nationwide. And through them, we've teamed up with churches and local community organizations. We've put on barbecues. We've done everything possible to make sure that the people who didn't have access to this, had people who spoke their language, had people who
Yeah.
looked at them, had people who understood sort of the cultural and sometimes religious contexts. Some people want somebody of the same sex as them to administer the vaccine. It's part of their culture. It's part of their religion. And so we took
Yeah.
all these things in mind and really just went one by one by one to address them. And our goal was every day to use all the capacity we possibly had and not have any extras at the end of the day. And so far, using those strategies, telling that story, making a plan that people could understand, and showing kind of the risk of not doing this, we've been able to not only fill those, but have days in advance those planned out so that people can get signed up and know where they're going.
Awesome, man, dude. I love it how it's just so similar to the sales process that we go through. Like you have the marketing, like, okay, let's get the word out, let's resolve those objections and the concerns people have. Because I mean, a lot of people I know having conversations with friends, they're like, yeah, I'm not getting vaccinated, and this is why. I'm like, okay, like we all get to make your own choices, but maybe those reasons aren't necessarily true. So I love it, man. What you guys have done to help us get through this pandemic and move forward, get back to normal. Really appreciate it.
Absolutely, and thank you. This has been a group effort, and you guys have been pivotal. So thanks for all your efforts as well.
All right, man. Well, with that, is there anything else you want to hit before we wrap it up, Patrick?
Listen, Billy, I would just say we have a lot of work to do, not
Yeah.
only in this pandemic, but I think healthcare in general has been turned upside down, and people are
Yeah.
now seeing that, even if they don't have a doctor's office close to their house, even if they don't go to a hospital regularly, they don't have a primary care provider, they can take responsibility for their own health. And this creates, a giant opportunity in the market for us to fill, to empower people and to disrupt this system that for so long so many people have complained about. And now, for the first time, because of all the changes this year, we see, hey, you know what? This is not going to be solved by governments. It's going to be solved by private industry. It's going to be solved by
Yeah.
entrepreneurship and innovation. And so, very excited about the future going forward. And I think there's going to be a lot of silver linings at the end of the tunnel.
All right, man. I appreciate it. I think you're spot on, and we'll talk later.
Thanks, Billy.